Hello, my name is Robbie Martin, physical therapist here at Trinity Health Systems. I'm a board certified specialist in geriatrics. I basically spend most of my time in the acute inpatient rehabilitation setting. I've been there for about 5 years. I've been a practicing physical therapist for about 5 years as well. Have worked in a variety of different settings. I've worked in home health. I've worked in the acute care setting, the skilled nursing setting, LTAC settings. I'm looking forward to getting back into the outpatient setting, treating geriatric patients, patients that are at risk for fall, different vestibular pathologies and whatnot. All right, Trinity's Balance Program, basically what we're looking to do here is to address the individuals that are at higher risk of falls. And we know, according to research, older adults, they're at the highest risk of falls primarily. Older adults older than 65. Statistics, more than 1 in 4 older adults, fall every year, and half of those individuals, talk to their doctors about it. Once you fall, you're at a higher risk of falling again. So it's an issue. It's a public health concern that we should be addressing. And here at Trinity Health Systems, we're taking that step to address that concern. So basically, we're looking to incorporate the program from the whole organization. We're looking to address the evaluation assessment of falls on the acute care side, the transition through skilled and rehabilitation settings, getting those patients that continue to still be at risk of falls that may be functioning at a par level. We want to get those patients into the clinic. We want to address their fall risk, identify risk factors. Myself as a therapist, I can address those risk factors with different strengthening and focusing on the actual components of the balance that that break down. And may it be this patient might have some foot problems, they might have a different weakness, they might have different vestibular problems, coordination deficits. We're looking to do that medically. They'll address the medications, reviewing medications, looking at for any type of medical etiology as well. Again, it's a collective program, and it takes in consideration multi-components. According to, again, the research, the American Geriatric Society and the British Geriatric Society, they recommend utilizing a multifactorial approach to developing a program, and that's exactly what we're doing here at Trinity. Trinity is utilizing the annual wellness visit to basically address preventative issues such as falls. So basically we're able to identify a patient that is at risk of falling. We're performing that multifactorial assessment. So the patient comes in and we address that there's concerns. They get the appropriate therapy, and then they're transitioned into the community. If the patient is at a low level of fall risk, then we transition directly into a community program. Those community programs, such as here at the Y, we're able to utilize different evidence-based programs, such as Tai Chi, Matter of Balance. These programs have tons of support within the literature that support, decreasing a person's risk of falling. Here at Trinity, we're focusing more and more on transition to care. Patient comes in through the acute care setting, and we're identifying specific deficits, their risk factors. We want to make sure that the correct patient is getting to the correct destination so that their level of function can be maximized. Okay, so some patients, they come in with just a few little balance deficits. They're a little unsteady gait. They get sent home. We want to make sure we're giving these patients an option to get some type of therapy to improve them deficits before they fall. Since the risk of falling is significant, and then the risk of having a fatal or non-fatal injury from a fall, it's very, very high, especially with individuals older than 65 years old. So this program will address both that patient and as well as the patient that might be more acutely ill, that needs a little bit more therapy. They're weak, they're not able to stand up, they're not able to transition as well. They need more assistance than their caregivers are able to provide. These patients are more appropriate for the skilled settings. We're utilizing outcome measures on both the acute care side, throughout the rehab side, and the skilled side. And again, with the transition into either home health after that discharge or into outpatient, depending on that patient's level of function. Individualized plan of cares are what needs to occur, and we are striving to make that happen. The benefits of utilizing an entire organization, being able to utilize Trinity's health systems network, is that we have the potential and we have the abilities to make the appropriate referrals. So we're able to refer to ophthalmologists, then we're able to refer to podiatrists, and then we have neurologists. In the acute setting, we have the disciplines that are OT, occupational therapy, physical therapy, we have speech pathology, and the same is true in the skilled and acute rehab settings. Being able to utilize these professionals to dig a little bit deeper into the deficits that increase the individual's risk of falling, it's vital. It gives us a direction of treatment. So it's a whole system that facilitates this program, and it supports this programs, and it drives, the patients into this program